Hello everyone. One of our patients asked whether I prefer Botox or PRP from permanent treatments for erectile dysfunction. PRP treatment is one of the most common treatments for erectile dysfunction. I have made a video about this before, and in the previous video I talked about the details about PRP. PRP should not be considered as a standalone treatment, it should be considered as a combined treatment with other treatments, such as medication, hormone therapy, or other treatments. The logic and healing mechanism of Botox treatment is different from the healing mechanism of PRP treatment. Therefore, we can use them in combination or we can use each of them separately. As you know, Botox has already been used in aesthetic surgery for wrinkles on the face for 15 years. Botox is actually a toxin obtained from a bacterium. The aim is to relax smooth muscle cells. When you apply it to the face, it relaxes the muscles on the face and makes the face flat. It removes the wrinkles there. It has a temporary effect. It creates an effect for about 6 months. It can be renewed after 6 months. What happens when we apply Botox to the penis is this: there are cavities that fill with blood when the penis hardens. The cavities in this cavernous body should both expand and fill with blood when the penis hardens so that venous leakage disappears after a certain pressure. The Botox toxin we give causes these cavities to expand. This has also been shown in animal studies. When Botox toxin is applied to the cavernous body, it ensures that these cavities remain permanently enlarged for 6 months to 1 year. So, are there any side effects? So far, there are about 10 scientific studies using Botox toxin in erectile dysfunction. There is no patient with any side effects due to the application. The application is done in the form of injection. It is entered with a thin needle and applied to the penis. It is an application that may cause small bruises, minimal bleeding. After the procedure, the patient continues his normal daily life. So, what is the benefit of Botox treatment on erection quality? Again, the response varies from patient to patient. If the patient has a severe erectile dysfunction, of course, the response to Botox decreases. But studies have shown us this. It is necessary to accept that the patients in these studies had moderate to severe erectile dysfunction. In other words, when we say moderate and severe, we mean the patient who only responds to Viagra. Sometimes he does not respond to Viagra either. Botox treatment is given to patients in this group. In patients, an increase in the blood flow to the penis by 50% to 60%, as well as an increase of around 50% in the erection quality of the penis is detected. Botox treatment is also a part of the treatment of erectile dysfunction. It actually constitutes a part of this treatment. It is absolutely necessary to perform treatment steps such as testosterone optimization, replacement of missing vitamins, lifestyle changes, re-evaluation and normalization of the relationship between the couple one by one. If only there was a treatment like this, the patient would come, we would give him an injection, send him away and the erectile dysfunction would be completely solved. There is no such treatment. But when we apply treatments such as Botox, PRP, shock wave, testosterone replacement therapy in a combined way, we find improvement in the complaints about erectile dysfunction in a very, very important part of the patients. There are patients who have advanced diabetes for 15 or 20 years and have experienced uncontrolled periods of diabetes, and these patients constitute a group of patients who are really resistant to treatment. For example, the patient has diabetes and has not had intercourse for 10 years. There is a very high level of destruction in the tissues due to diabetes. Of course, the treatment you will give this patient will have a low response. But there are other patients that we can get a very good response.